Children are innocent. They're playful, curious, unassuming, and let's be honest, sometimes they're a little obnoxious. When they get sick, though, everything changes. It's sometimes really scary to take care of pediatric patients. We want to provide you with the best tools possible and take some of the trepidation out of caring for kids. Signs of deterioration in pediatric patients are often subtle. Research shows that when certain signs are demonstrated together, they're an excellent predictor of worsening condition in pediatric patients. But if they're subtle, how do we bring focus to them specifically? Through careful consideration, we've decided to begin using the Pediatric Early Warning Score, or Pews, for all of our pediatric patients. Why the Pews score? It's a validated and reliable tool. Through scoring, it detects subtle signs of clinical deterioration in pediatric patients. It's used in facilities across the country. It's a tool to aid in validating your clinical judgment by providing an objective method of measuring clinical status. Studies show that after implementation of such a scoring system, staff members' confidence in recognizing children at risk increases significantly. The scoring system focuses on 3 categories you're already assessing: behavior, cardiovascular, and respiratory status. All of these parameters individually are valid measures of severity of illness. What the Pews score does is quantify these trends and assessments. Retrospective studies have shown Pews scores begin increasing, indicating clinical deterioration on average up to 11 hours prior to a code blue activation. Behavior will be assessed based on the patient's level of consciousness. Cardiovascular status is assessed based on the patient's color, capillary refill, and heart rate. Respiratory status will be assessed based on respiratory rate and oxygen demand. The patient receives a score between 0 and 3 in each of the categories based on clinical presentation. The scoring framework allows for extra points to be assessed for those patients who require increased interventions, like every 15-minute nebulized treatments or continuous nebulized treatments, in addition to persistent vomiting postoperatively. As calculated, the Pews score will range between 0 and 13. Higher scores correlate with the greatest risk of clinical deterioration. When documenting in Meditech, the intervention will automatically calculate the appropriate score for you. Along with the scoring system, we've developed an action algorithm to help drive your clinical decision-making. Once your patient is scored, this algorithm will assist you by guiding your assessment frequency and other interventions that may be available to you. Again, our purpose is to drive clinical decision-making, but it should not be a substitute for clinical judgment. Our pediatric patients will be scored on admission every 4 hours and as needed for changing statuses. Pews scores should be conveyed during handoffs and transitions in care. In addition, Pews scores that are increasing should be discussed during daily safety huddles. The scoring tool and algorithm are available to you in Qualtrics. Now let's take a look at some videos. We will use the Pews tool to evaluate patients and calculate the score. In our first video, we have a 4-month-old who is ill but behaving appropriately. She's pink and appears well oxygenated. Her heart rate is within normal limits, but her respiratory rate is elevated and she demonstrates some subcostal retractions. Before we watch the next video, I want to briefly discuss lethargy in children. Lethargy goes beyond the child's normal sleep pattern. It speaks more to the way the child is interacting with their environment. Are they alert? Are they active and engaged? Sick children are irritable, but usually easily consoled by their parents. Lethargic children will not show irritability, or they'll appear withdrawn. Any healthy child will respond to irritating or painful stimuli. Decreased responsiveness to either of those indicates lethargy. In our next video, we see a 4-year-old boy. His heart rate is a little elevated, most likely from the work of breathing. His respiratory rate is 32, which falls into the parameters that would give him 1 point. Now that you've learned about the Pews assessment tool, we want you to do the next assessment on your own. Watch the video. Using the data presented in your visual assessment of the patient, mark your responses and calculate the score on your handout. Make sure you turn your handout into your unit educator or manager for review. You may pause the video or rewind to the beginning as necessary. Now let's review some of the things you've learned today. The Pediatric Early Warning Score is a tool used to aid in developing situational awareness where pediatric patients are concerned. It uses 3 categories to determine scores: behavior, cardiovascular status, and respiratory status. Studies have shown that the Pews score is an accurate and valid tool indicating clinical deterioration in pediatric patients. Thank you for your participation and your attention, and thank you for protecting and defending the smallest in our community with your awesome care and compassion.